Thank you for listening to Depictions Media Radio.
Hola y muy buenos días a todos. Bienvenidos a esta sesión informativa semanal de la OPS sobre la pandemia por COVID-19 en la región de las Américas. Soy Sebastián Oliel, del Departamento de Comunicación de la OPS.
Sebastián Oriel with the Communications Department here at PAHO, and let me remind you that we have simultaneous interpretation into English and into Spanish, and you can choose interpretation through interpretation button at the bottom of the screen. This session will be 45 minutes to 1 hour long, and we will be accepting your questions. Till then, we have received several questions via email, but you can also send your questions using the chat function at the Q&A button. And please do include your name and your media outlet when making your question. And also, we will be giving the floor to you live, but first let's coordinate through the Q&A chat. Through the chat. Today, the director, Mrs. Etienne, Carissa Etienne, will be reporting on comorbidities and the pandemic situation in the Americas. We have today with her Dr. Jarbas Barbosa, Assistant Director of PAHO, Mr. Ciro Ugarte, Health Emergencies Department Director, also with PAHO, Mr. Marcos Espinal, who is the Director of Communicable Diseases with PAHO, and Dr. Sylvain Aldiguieri, who is the Deputy Director with the Health Emergencies Department and also Incident Director for COVID-19. Now, I would like to give the floor to Dr. Carissa Etienne for her opening remarks.
Good morning, and thank you for joining today's press briefing. As of July 20th, there has been 7.7 million cases and more than 311,000 deaths reported in the Americas. The COVID-19 pandemic is showing no signs of slowing down in our region. During the last week, there were almost 900,000 new cases and nearly 22,000 deaths reported in our region. Most of these within Brazil, Mexico, and the United States of America. While most countries in North America are witnessing a surge in cases, Canada has been able to flatten its epidemic curve. Further south, several Caribbean countries have implemented effective travel restrictions and managed to control clusters of outbreaks, and as a result, have now resumed non-essential travel. Most countries in Mesoamerica are reporting their highest weekly increases of COVID-19 cases since the pandemic began. In South America, COVID-19 continues to spread in the Amazon basin, with countries such as Bolivia, Ecuador, Colombia, and Peru seeing significant surges in cases, particularly in localized hotspots. Also, in the past weeks, we have observed the virus spreading to the countries of the Guiana Shield, such as French Guiana, Suriname, and Guyana. Countries in the Southern Cone, like Chile, Argentina, and Uruguay, have made important progress in strengthening influenza surveillance and carrying out flu vaccination campaigns in the last few months. There has been very low circulation of influenza reported in these countries, which suggests that hand hygiene and social distancing can also contribute to the reduction of other respiratory viruses. Countries must rely on accurate and timely data about the spread of COVID-19 to guide their actions. Analyzing this data in real time will help leaders determine whether it is safe to consider reopening or if it's more important than ever to boost hospital capacity and implement the public health measures that we know save lives. It is through better, more detailed data that we have learned that some people are more prone to get sick from COVID-19 than others. Research shows that certain underlying chronic conditions like diabetes, kidney disease, and hypertension, as well as infectious diseases such as HIV and tuberculosis, place people at increased risk for more severe COVID-19 disease. Unfortunately, many of these medical conditions are widespread in the Americas, which leaves our region more vulnerable to severe illness. Thanks to a new partnership with the London School of Hygiene and Tropical Medicine, PAHO has developed a data model that provides a more accurate picture of the prevalence of health conditions in our region. And what we see is worrisome. Across the Americas, 3 out of 10 people, or nearly 325 million people, are at increased risk of developing severe COVID-19 illness due to underlying health conditions. We are talking about 186 million people in Latin America and the Caribbean. And in North America sub-region, which includes the US and Canada, the data show that 1 in 3 are at increased risk of severe COVID-19. Among people with comorbidities in the Americas, there are 43 million at high risk, which means they would require hospitalization due to their underlying health conditions. And within this group, men are twice as likely as women to be at high risk of developing severe COVID-19. Since the likelihood of developing multiple health conditions increases with age, people over the age of 65 are at great risk of experiencing more severe disease. But working age adults, which refers to people from 15 to 64, are not immune, as many of them live with one or more underlying health condition. Diabetes and chronic kidney disease in particular are especially prevalent among adult populations. Over the next few weeks, PAHO will be rolling out a new tool for member states based on the adapted model that we referred to, which was developed with the London School of Hygiene and Tropical Medicine. This will enable countries to use regional and country-specific data on the prevalence of comorbidities to adapt their COVID-19 responses and to better protect their vulnerable populations from chronic conditions that threaten their health. Again, data must underpin our actions. First, knowing who is at risk will help countries develop strategies to protect people with comorbidities. From self-isolation with assistance to providing adequate resources and support systems, such interventions can help countries reduce deaths among the vulnerable groups, while also helping to flatten the curve and preserve the capacity of health services. Second, with the surge in COVID-19 patients, many health systems lack the staff, the space, and supplies to adequately offer routine care. Such disruptions have delayed treatments for cancer patients and dialysis for those with chronic kidney diseases. People with diabetes are running out of insulin, and HIV patients have to worry about continuing their treatment. With the new tool, countries can tailor their responses to protect vulnerable groups from risk and implement innovative programs to help people safely and more consistently manage their conditions. This includes increasing telemedicine capabilities and establishing surge points for care, which allows people with chronic conditions to be seen by a doctor away from suspected COVID-19 patients. PAHO has been supporting countries since the onset of the pandemic by conducting needs assessments and helping countries expand their supplies and staff to protect the resiliency of health systems while fighting COVID-19. Third, countries can also issue more specific guidance to people prone to severe COVID-19. For instance, vulnerable groups should be advised to connect with their healthcare providers to ensure that they have the medications and supplies they need to safely manage their condition. This is also the time to rely on friends and family to run errands so they can minimize their trips outside of their homes. And as much as possible, people should maintain a healthy routine at home that includes regular exercise and nutritious food. Taken together, these strategies can minimize the spread of COVID-19. They can help to reduce deaths and to protect our health systems. The arrival of COVID-19 introduced a grave new threat to the health of our societies. But it has also shone a revealing light on the prevalence of diseases and conditions that have plagued our regions for decades. The impact of comorbidities on the spread of the virus should be a clarion call to every country in the Americas to use data to tailor your response and make health your top priority. Strengthen your health systems by responding to emerging needs that is informed by better data. And boost your capacity, improve your quality of care, and make health more accessible to the poorest and most vulnerable. Let's ensure that our response to the pandemic does more than stop COVID-19. Let's build a healthier, more resilient region that is better prepared to take on the next challenge. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. We are going to start now with the questions that we have received via email, and then we will look at the questions we have on the chat. And as you know, by using Q&A, you can write your questions, and we ask you to identify by saying your name and media outlet. The first question that we have received is as follows.
Activities, many people will seek health care and may risk overwhelming health services at a critical moment. How should health services prepare for the reopening? Dr. Etienne?
Let me thank you for asking this very important question, which all countries must consider. Once conditions are given for countries to reopen, health services will have the challenge to resume routine and essential services and may well become overwhelmed by the surge of demand, while at the same time sustaining and expanding health services capacities to respond to COVID-19. And this may lead to the overwhelming of health services. Health services must find a way to expand capacities of health centers and ambulatory specialized care with adequate health personnel, pharmacy, laboratory, and diagnostic services, including extended hours for emergency care. It is also necessary to ensure the availability of medicines and supplies. But they will also need to be reorganized for the provision of these essential services, particularly at the first level of care. This means they will have to prioritize groups at risk or in conditions of vulnerability and define modalities of services, including coordination among different healthcare providers and the creation of strengthening of networks of healthcare delivery. Health centers should implement infection prevention and control measures and make rational use of PPEs. That includes reorganizing the physical space, clearly identifying areas for internal circulation of health personnel and patients, reinforcing the physical infrastructure for adequate distancing in waiting rooms, triage, and separate patient flows. Furthermore, all health personnel should be provided with PPEs following established protocols. They should continue building on using information technology, teleconsultation, telemedicine, call centers to support the delivery of essential services. Governments should also make arrangements with the private sector to increase response capacity with due attention to regulation and clear mechanisms for infection prevention and control and coordination and communication. For all of this, political commitment and leadership will be essential to ensure that the necessary resources are allocated and that executive decisions are made to facilitate some of the changes required. At the end, COVID-19 is showing us that strengthening of primary health care is essential within the pandemic and after the pandemic. Thanks again for this question.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. The next question that we have just received is linked to vaccines. We have received these questions via email, and we also have several questions in our chat. So we'll try to put them together. Claudia Luna Palencia from Vertigo. Radio Azteca is asking whether the countries are going to have their own coronavirus vaccine and also how this vaccine will be offered. Gerardo Suarez from El Heraldo in Mexico is asking whether the revolving fund will be used for the COVID vaccine, and from Brazil, we're being asked whether all of the questions that are part of the revolving fund are eligible to be part of the COVAX mechanism that we mentioned last week, or whether they need to express their interest, and also whether Brazil is part of this initiative. Dr. Barbosa, could you please address these questions? Yes, thank you very much. There are great expectations throughout the world in connection with the vaccines. First of all, we do not have the vaccine, and it is important to continue implementing all of the prevention measures and also to observe the recommendations by governments. So there is an incredible effort around the world to have a COVID-19 vaccine. We have between 50 and 60 projects. 5 and 6 vaccines are already in phase 3 of the clinical trials. Before administering a vaccine, we need to prove that that vaccine is safe and that can be efficiently administrated. So we need to study at the lab level and also on individuals. Phase 3, we have 1, 2, and 3 phases. Phase 3 is the final stage, the final phase, but it may take several months because it has to be tested in 40,000 to 50,000 people. So it is important for those vaccines to get to the end of the process and also to confirm that they can prevent infection through COVID-19. There will be several vaccines coming to the market. There are several vaccines in phases 2 and 3. It is quite likely that the countries will have several opportunities within the next 6 months to 8 months and to a year period. And then we have the issue of equitable access or equal access. So there are some very innovative vaccines that may have some difficulties in reaching a surge in their capacity in the short term. So the best measure to prevent this uncertainty in connection with the uncertainty of the vaccine is for the countries to work in coordination. As we discussed last week, we have the COVAX mechanism that was coordinated with WHO, Gavi, and other partners. That mechanism allows for all of the vaccines that reach a specific level and that already have a good likelihood of being safe and efficient. That mechanism allows for the reservation of a specific number of vaccines. We have that this is done through the through contact with the producer of that vaccine, with the manufacturer, and we have already reserved 300 million with the one that is the most advanced so far. The idea is to have enough number of doses that will be enough to attain the goal in the first stage to provide access to all of the countries to be 20% of their population, so that we can vaccinate those that are older than 65, health professionals, and also adults with underlying conditions. And the revolving fund can be an instrument, a tool for the countries in Latin America and the Caribbean to access the vaccine. We already received 38 letters from countries expressing their interest to have access to COVAX. The revolving fund has over 40 years of experience in the purchase of vaccines at the international level. So all of the regulatory issues, all of the administrative issues, as well as legal issues, can also be accelerated through the fund, and we are also accepting invitations, and that's the reason we're accepting the request for participation from the various countries at this point in time. Thank you very much. The next question is by Mike Keller from Voices Q, Canadian reporter, and it reads,
Americas who are complicit in either passing along erroneous public health information on COVID-19 or denying it altogether or calling it a hoax. Are there any measures the international community can take to censor these leaders? Doctor Espinal podría tomar esta pregunta.
Thank you very much, Michael, for the question. It is an important one, but I don't think it's a matter of censoring leaders and politicians. I think the answer is that we, the international public health agencies, academia, and centers of research continue providing the best evidence to show these leaders that this is not a joke. This is a public health crisis. We understand there is also, this is going accompanied by social and economic implications. But the most important evidence shows that the problem we're facing, it's a problem that we still don't have a solution completely. We don't have yet the vaccine. We don't have yet medicines approved. But on the other hand, what we are seeing is increasing mortality. So we're seeing 600,000 deaths globally. So that's the most important evidence to show and convince leaders that if they have doubts about this, we are here to help them to continue navigating the response to this pandemic. And our offices in countries of the region are always at the disposal of those leaders to ensure that we provide the best technical cooperation and guidance. The most important thing is that, and that's the most important issue, mortality. And life is a very precious thing. So that's the most convincing issue. And finally, we have seen how prime ministers and president has been affected. So that is a question maybe to pose to them now that it's important that they are experiencing, unfortunately, this pandemic. Thank you.
Gracias, doctor. La próxima pregunta es
Thank you very much, Dr. Espinal. We have the next question by Nercia Charmal from Choice TV, St. Lucia. The question is,
the Caribbean states like Antigua, St. Lucia, and the Bahamas, who have reopened to visitors, especially to tourists from the United States, where the caseload is growing daily. Doctor Aldiguieri, ¿podría tomar esta pregunta?
Thanks a lot for this question to the colleague from St. Lucia. I'd like first to acknowledge that the countries of the Caribbean region are reporting all cases related to travelers to Pan American Health Organization through the international health regulations. This is important to mention. In each country, the decision-making process for reopening the airspace and resuming non-essential travel is a complex mechanism. It includes economical factors and diplomatic factors and others. It's important to flag that resuming incoming non-essential travel is not exempt from the risk of importation of SARS-CoV-2, which is the pathogen of COVID-19. The decision to resume the non-essential travel should be gradual and will be dynamic in terms of adjusting the restrictions. The pre-travel testing could create a false sense of security. As an example, a traveler from a location with widespread community transmission could be infected between the time the sample was taken and when the person boarded the flight. And a negative test upon arrival could also occur in the early stages of the infection. So in order to manage the risk of importation following resuming non-essential travel, countries should ensure a series of actions and procedures in place. Mechanisms in place at national level to locate the incoming international travelers, existing modalities for monitoring the health status of the international travelers. Information should be available to these international travelers regarding the symptoms of COVID-19. Contact tracing procedures must be established and contact tracing teams ready to intervene. To ensure the expansion of the laboratory network using the golden standard PCR test. And I would say that the most important is the strengthening of the primary healthcare system. This is the core of the preparedness and response for the response to this kind of situation. Thank you.
Muchas gracias, doctor.
Thank you very much. Now the next question is by Tom Lister from CNN. And he says,
Daniel Ortega said that only 91 people had died from COVID-19 in Nicaragua. Is PAHO satisfied with the quality of data coming from Nicaragua? And does it have a view of the very figures from the COVID-19 Citizens Observatory? Doctor Ugarte, ¿podría tomar esta pregunta?
Thank you. As you well know, Nicaragua reports only once a week and has not reported the detailed epidemiological information as established in the international health regulations, regardless of multiple written and verbal requests. So that information that PAHO did not receive yet includes disaggregated data by sex, age, location, confirmation, number of tests, and several others. So the lack of proper information does not allow PAHO to properly assess the situation in Nicaragua. And in the absence of detailed, transparent of information, must be considered in order to assess the situation and describe better what is happening inside the country. And especially for the population, because the population must implement protective measures, including universal use of masks, hand washing, physical distancing, and others. And I would like to highlight also that in order to properly assess the situation, PAHO requested to be allowed to send a group of experts. And that team of experts has not been, we have not received yet the concurrence of the government to send those experts in order to support Nicaragua's response to the pandemic, but also to strengthen our capacity at the country level. Thank you.
Muchas gracias, doctor. Me gustaría ahora darle la palabra.
Thank you, doctor. I would now like to call on Barbara Fraser. Barbara, if you are listening, You can
Buenos dias.
turn on your screen.
I'm Barbara Fraser. I'm a freelance journalist based in Lima, Peru. And my question is this. There are indigenous groups in Peru and other countries have said that health services are slow to respond to their communities' needs and insensitive to cultural differences. They also say that messages about prevention, although translated into indigenous languages, do not take into account the community's living conditions and their way of understanding health and illness. As the pandemic continues to spread in indigenous communities, especially in the Amazon, what are the most important steps that healthcare providers must take now to effectively address the needs of indigenous communities? Thank you.
Gracias, Bárbara. Doctora Aldiguieri podría tomar esta pregunta.
Thank you, Barbara.
Thank you.
Dr. Aldiguieri, could you please take that question?
This question, it's very important, and I'd like also to flag the network of journalists working on indigenous health, and that are helping a lot in catalyzing our efforts for having our message in terms of prevention of COVID-19 among indigenous communities. During the last month, Dr. Etienne, during this Tuesday briefing, had flagged hotspots in some areas of the Amazon. At the moment, around the tri-border area between Brazil, Peru, and Colombia, and on the western part of the Amazon basin. And today, Dr. Etienne again flagged the spread to the north to the countries of the Guyanese Shield, including among indigenous population of the hinterland of these countries. The COVID-19 pandemic poses a risk to the health of indigenous people, both people living in urban areas and living in remote settlements, remote, hard-to-reach communities. PAHO, during the last month, 1 month ago, has published guidelines for helping the national and local authorities in integrating indigenous health for the COVID response. And last week published an AP update regarding the situation among selected areas of the continent. To interrupt the transmission of COVID-19 or to control it in indigenous communities, we recommend that indigenous leaders participate in actions to detect the cases as early as possible and isolating the positive cases and participate in the contact tracing activities, of course, in a context of infection prevention and control. Surveillance strategies among indigenous communities should include community surveillance. It is where you have the participation of the indigenous leaders. And I'd like to highlight the importance of reporting the rumors. Different cultures have a different way to interpret it, the rumors. So it's important to include local leaders in the interpretation of these rumors. We would like also to flag the importance of good communication in COVID-19. It's not only a matter of translation. It's also adapting the messages to consider local practices and with symbolic symbols and images when needed. I like to stress the importance of adapting the messages. And also for the local health authority, there is a need to better link, better include the traditional practitioners. There is a way, this is the way that the communities would better accept social distancing, isolation, and this would help to fit with their views of the world and existing ancestral knowledge. But also, there is no one strategy for all the communities. Different strategies are needed for indigenous people living in urban areas. I think in the Amazon basin, it's about 50% of the indigenous population already living in urban areas, and also in remote communities, but also in migrant indigenous population. We will have, again, to work together for developing these specific strategies in order to have a better prevention and control of COVID-19 in these communities. Thank you.
Gracias, doctor. Me gustaría ahora también dar la palabra.
Thank you, doctor. Now I call on Melina Ochoa, who is a reporter from OTV, Mexico City. Otelina, the floor is yours. We can't hear you.
Hola, muy buenos días.
Hello and good morning. Okay, we can hear you just fine.
Perfecto. Muy buenos días a
Good.
todos.
Good morning, everyone.
Sobre lo que comentaban de las vacunas de los
Regarding what you were
38
saying
países que han
about the
enviado
vaccines
petición
in
para
the
el acceso,
38 different
México
countries
está
that
en
have
esta
applied for
lista
access.
de ingreso
Is
dentro de estos
Mexico on
38
that
países
list?
que ha enviado
Is Mexico included
esta
on that list of the
petición
38
y preguntar,
countries
la
that have applied
OPS ha
or that
detectado
have
rebrotes
expressed interest?
justamente
And
en países como
also,
México y a qué cree que
has
se deben.
PAHO
Muchas gracias.
detected flare-ups in countries like Mexico, and why do you think those flare-ups occurred? Dr. Barbosa, could you take that question? Yes. Yes, Mexico is on the list. Almost all the countries of Latin America and the Caribbean and the territories have already submitted their letters. So we think that all countries of Latin America and the Caribbean will definitely participate in a coordinated, joint way, and that greatly increases the possibility of quicker and more equitable access to a new vaccine against COVID-19. Now, the Secretariat of Health in Mexico has been coordinating the situation. And as Director Etienne said, just like Brazil, Chile, the countries of Latin America are seeing that spread is going up. But every country has to see what is happening within its own borders. Now, the Secretariat of Health in Mexico is reporting that there is no state that is in green. Everyone is either orange or red, and that means that contagion is significant. Also, it's important to monitor hospital bed occupation. There, Mexico apparently is under control. There is no critical situation there. So the truth is, we are still in that first round of transmission. The countries of Latin America that have been able to slow the speed of transmission, for some weeks they have seen a plateauing, but a plateauing at a high level. And the trend is still upward in many provinces, many states. So we have to continue to monitor and to implement social distancing measures. We have to continue with the efforts being made by Mexico to increase capacity and to be able to provide tests to all suspicious cases, then monitor contacts, test health staff, and test in areas where there is crowding, in housing, where we have housing for the elderly. So there has to be a strategy to monitor exactly where the virus is being transmitted and there apply measures to interrupt that transmission. Thank you. Thank you, Doctor. The next question comes from Luis Madrigal from Elfino CR, Costa Rica. Luis is saying that Costa Rica continues to see an accelerated increase in the pandemic, not only in the number of cases, but in deaths. There are hundreds of cases where it hasn't been possible to do contact tracing because of the collapse of the system in charge of that effort. So the question is, what strategy should be followed by countries like Costa Rica that find themselves in the situation and cannot interrupt the contagion chain? And also, what does PAHO think of the higher positive results, which in recent days in the country is 50%? Dr. Ugarte, could you take that question? Yes, thank you, Luis, for your question. I would like to begin by saying that Costa Rica was an early implementer of epidemiological tracking during the pandemic. It has been following up on cases and contacts, basically following PAHO and WHO recommendations. And it has a clear focus on the cases that are along the borders and peri-urban areas in migrant populations. But there is a lack of information regarding other places, other sites, and probably because of that, the number of cases has gone up. We're seeing a second rapid increase in the number of cases in areas where they had eased physical distancing, but also with the perception that since they had just a few cases, they may have felt more willing to go outside and leave measures aside. That doesn't mean that the situation has improved. As I said, that second uptick in the number of cases seems to be related to the pressure of the pandemic's progress throughout the region, also the settlements in the north, but several areas in Costa Rica have been affected. I think that excess confidence has to be offset by increasing physical distancing once we lose control of the virus. Now, Dr. Alighieri, Dr. Barbosa, Dr. Espinal have said that. The director also mentioned it in her opening remarks. We have to continue following strict measures. They are absolutely essential for the detection, and that way we can do immediate isolation of confirmed and suspicious cases. So again, detection and isolation of all confirmed or suspicious cases, a quarantine of all contacts, treatment, hospitalization of all the cases that so require, and massive and strict implementation of the public health measures, including the wearing of face coverings, masks, hand washing, the use of hand sanitizers, and understanding that physical distancing is essential. If we do not do that, we're definitely going to witness situations like those that we have seen, not only in this region, in Europe and other regions too. And I think that countries have to realize that relaxing measures, opening up their economies, has to be linked to epidemiological information, the capacity of their healthcare services, and basically the actions of each and every individual, because we all have a contribution to make. Thank you, Doctor. The next question comes from Ana Lucia Ola, Prensa Libre, Guatemala. It says, studies say that the tuberculosis vaccine can have a positive effect on people that have COVID-19. And it's said that this could help reduce the mortality because of novel coronavirus. What would the Pan American Health Organization say in this regard? Dr. Espinal, can you take that question? Yes, it's an important question. For several months, it has been thought that the BCG vaccine could have a protective effect against COVID, and that countries that have been vaccinating with BCG for a long time have lower mortality rates. But a recently published study in a prestigious journal has shown some evidence that countries that have vaccinated with BCG for a long time do have slightly less mortality. But this isn't a prospective study. It isn't a double-blind trial on the effects of BCG. And so this type of study has that weakness. It doesn't determine causality. It's only an indication. There can be other variables, factors that aren't taken into account. So the study suggested that perhaps BCG, because BCG has a long history, it trains the immune system to not only fight tuberculosis, which is a system with another type of immunity. That is why BCG is used for bladder cancer, because it's been thought that it can train the immune system to fight off pathogens that get into our bodies. Now, to be able to show that there is a real effect of BCG on COVID, we would need clinical trials. And those are being carried out in Holland and Australia. And when the time comes, we will have evidence so as to be able to reach more reliable conclusions on the potential impact of the BCG vaccine. But in any case, our countries are still experiencing deaths because of COVID, so we will have to wait to see what the results are of these clinical trials in the countries that I just mentioned. Thank you, Doctor. The next question comes from Linda Straker from Grenada. She says,
of the test conducted in the USA and in the Caribbean, a number of visitors who tested negative in the US are tested positive in the region, and in one case, a group which tested positive was tested negative in the US. ¿El doctor Alighieri podría abordar esta pregunta?
Dr. Alighieri, could you take that question, please?
I'm sorry. I think I was disconnected, as you may have noticed. Could you repeat the question, Sebastian?
Sí. La pregunta dice...
Yes. The question says...
In the calibration of the test conducted in the US and in the Caribbean, a number of visitors who tested negative in the US are tested positive in the region, and in one case, a group which tested positive was tested negative in the US.
Yes, thank you. Thank you for these questions. I think that I partially answered this question during my earlier during this press conference. But in any case, the golden standard in terms of testing is the PCR. It means a molecular test that would detect the genome of the virus. An American Health Organization is not recommending a rapid test using antibodies for the detection of acute cases. This is the first comment. The second comment is that most of the countries and territories in the Caribbean have established or strengthened their PCR testing capacity. And PAHO and CARFA, the Caribbean Public Health Agency, are working together on doing the quality control of the testing, a quality insurance program, in order to have reliable tests at country level. The fact is, it's not a problem of calibration of tests. It is what I tried to explain earlier. A traveler coming from a location with widespread community transmission could be infected between the moment he was tested before flying and the moment he boards his flight. This is one point. And also, a negative test upon arrival could also occur at the early stages of the infection. So it means that the travelers would develop a fever or cough or other symptomatology, later during their stay in the country and will be tested at the moment of the detection of a symptomatology when they will be detected by the surveillance system. I hope I have answered the concerns from the colleagues in the Caribbean regarding this question. Over.
Gracias, doctor.
Thank you, doctor. The next question comes from Matias Elodi, Medscape in Spanish, saying, in Latin America, there are access protocols and 24 of trials about convalescent plasma and patients with COVID-19. And the question is, what do you think of the potential benefits of this approach? Dr. Barbosa. Yes, thank you. In Latin America, there is experience using convalescent plasma to try to treat hemorrhagic fever in Argentina. But that is one of the approaches being used right now. And it's important that there be clinical trials developed for convalescent plasma and other therapies, because we don't yet have any medicine to recommend for prevention or for the specific treatment of COVID-19. So we need to experiment with a very strict medical parameters so that the people that participate be protected in terms of their rights. So we always support the countries that want, that need methodological regulatory support so that the other countries in the region can carry out clinical trials and thus seek out a more effective treatment against COVID-19. Now, an assessment regarding the use of convalescent plasma will only be possible once the trials being carried out in the countries reach an end. Thank you, Doctor. The next question comes from René Mira from Rainbow Media.
What she calls the pandemic of mental illness caused by COVID-19. Doctor Espinal podría tomar esta pregunta.
Thank you very much. René, a very important question. The region and the countries and the organization, PAHO, has been very proactive in addressing this issue because it's one of the most important consequences of COVID to make sure we protect the mental health of our people. And not only our people, also our health care workers, which is the front line to battle the COVID pandemic. We have plenty of best practices, experiences in countries like, for instance, setting up of hotlines, consultations in countries like Trinidad and Tobago, plans and strategics, booklets in Guyana, for instance, but also if countries, we're providing technical cooperation in the format of virtual technical cooperation, like webinars with the countries in addressing and answering all these questions about mental health. But something that is important to mention is if you visit our website, PAHO.org and page under COVID, plenty of information, infographics, about not only managing mental health in the general population, but also in children to cope with the stress, for young people, technical guidance on how to approach the issue. It's a very rich process, and of course, it's something that it's ongoing and must continue because until we don't see light at the end of the tunnel, we will have to continue dealing with protecting the mental fit of our populations. And our country offices are also very engaged with our countries in providing technical cooperation. So there is more information to visit mine all the information on our website. But there are issues that are, you can tell, technical cooperation, webinars, virtual visits, and also constant communication between our country offices and our experts at country level and the Ministries of Health and national authorities. Thank you.
Gracias, doctor. Ya estamos llegando al final.
Thank you, doctor. We are coming to the end of the session, but we have another question from Muraña Molina, Diario La Prensa, Panama, saying in Panama, they are again using hydroxychloroquine to treat COVID-19, this time by medical prescription. And the question is, what does PAHO and WHO think about the use of this medicine? Dr. Alieri, please. Thank you very much for this opportunity. I would like to once again highlight that the Pan American Health Organization does not recommend the use of hydroxychloroquine to treat COVID-19. Studies, including a hydroxychloroquine arm, it was a study called Solidarity. Those studies were stopped, and there were several articles in the international journals of greatest prestige that show inefficiency of hydroxychloroquine for treatment of COVID-19. So it's important to highlight those important aspects. Thank you, doctor. And now one final question.
The weakness of the health systems in the region of the Americas, and what would be the change forward after COVID-19 for healthcare? Dr. Etienne?
Thank you. Absolutely. The spread of COVID-19 has exposed the weaknesses of health systems in the Americas and the lack of adequate investment and the lack of priority that has been afforded to the development of health systems over time. The challenges of our health systems can be attributed to a long history of segmentation in the Americas and prioritization of hospital-centric, specialized, curative, and episodic models of care. However, COVID-19 has clearly shown us that access to healthcare is not yet a reality for rural populations, for the poor and other vulnerable groups in the Americas, these groups who are consistently being left behind. COVID-19 has further shown us that it is time to reset policy and to transform health systems based on primary health care so that no one is left behind. And we know how to do it. Just last year, I launched a report of the PAHO Commission on Primary Health Care for Universal Health, 40 Years of Alma Ata, that provided 10 critical recommendations for countries and 25 actions to transform health systems based on primary health care. In addition, at that time, we called for a regional compact on primary health care, urging countries to invest at least 30% of public health expenditure at the first level of care to reduce barriers to access by 30% by 2030. 30. Now is the time for action to expand healthcare networks to reach all communities and territories, to increase access to health services at the primary care level using teams of health professionals, including through digital technologies, to improve community outreach and health surveillance at the community level, and to ensure social protection in health at the community level, including the provision of health care free of charge at the point of delivery. It is through this vision of primary health care that we can improve the response of health systems, both in normal and emergency times. And it is now, with COVID-19, that we have the opportunity to strengthen primary health care in the road towards universal health access, and universal health coverage, addressing the needs of all the population, no matter where they are or who they are, so that no one will be left behind. Thanks for joining us today.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne, and I wanted to thank everyone for taking part in this session. We will be sending you the opening remarks of Director Etienne soon, and also the recording of this session. We weren't able to cover everyone's questions, but please do stay in contact with us through email. We will get back to you as quickly as we can. So thank you, and we'll.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.